Hello there, everyone. Before we start today, I would like to ask, what is warfarin? Warfarin has the brand name of Coumadin. It is an oral anticoagulant which will antagonize the action of vitamin K involved with blood clotting mechanism. Warfarin is mainly used to prevent and treat thrombosis in various clinical settings. Warfarin is monitored using INR. What do you know about INR? INR is an international normalized ratio. It is an assay used to evaluate the extrinsic pathway of coagulation from the use of warfarin. A healthy person has an INR of 0.9 to 1, while a common target for INR with patients taking warfarin is 2 to 3. If a person has an INR above the normal value, he or she will have a high risk of bleeding. Meanwhile, if he or she has an INR below the normal value, there is a high risk of developing blood clots. Warfarin tablets have different colors indicated for each strength. In Malaysia, the common strengths of warfarin found are 1, 2, 3, and 5 mg. Next, do you know the indications of warfarin? The common indications for warfarin use would be atrial fibrillation, prostatic heart valve, deep vein thrombosis, and pulmonary embolism. Atrial fibrillation is an abnormal heart rhythm. The target INR for chronic atrial fibrillation will be 2 to 3 and warfarin is given for lifelong. Cardioversion has the target INR of 2 to 3 and warfarin is usually prescribed 3 weeks before and 4 weeks after atrial fibrillation if normal sinus is maintained. Warfarin is used in prostatic heart valve to prevent valve thrombosis and systemic embolism. The target INR for aortic valve replacement with no risk factors will be 2 to 3, while mitral and aortic valve replacement with risk factors such as history of embolism and atrial fibrillation will be 2.5 to 3.5. Deep vein thrombosis happens when there is thrombus formation at the vein underlying the skin, usually at the peripheral. The target INR for warfarin used during the first episode will be 2 to 3. High risk of recurrent thrombosis is 2 to 3, while thrombosis associated with antiphospholipid antibody will be 3 to 4. Warfarin is also used in pulmonary embolism, which it is a condition of thrombus dislodging and traveling as embolus to the lungs to form blockage. The target INR for first episode will be 2 to 3, and for individuals with high risk of recurrent embolism will be 2 to 3 as well. Although warfarin is widely used in various clinical settings, there are several limitations of warfarin such as slow onset of action, no direct effect on an established thrombus, and it does not reverse ischemic tissue damage. Do you know when is warfarin use contraindicated? Warfarin is usually contraindicated before surgery, during pregnancy because it can cause fetal warfarin syndrome, recent hemorrhage, congenital blood clotting disorders such as hemophilia, severe liver disorder, high risk of fall, especially the elderly, and inability to have INR determined. Fetal warfarin syndrome happens due to the warfarin used during pregnancy. Warfarin can cross the placenta and inhibit the clotting factors of the fetus. Abnormalities observed in fetus will be low birth weight, mental retardation, small head size, deafness, and malformed bones and joints. Pregnancy category for warfarin will be X. That is all from us about the indications and contraindications of warfarin. It is brought to you by Ang Si Peng, Angel Gowei Ling, and Lim Woon Zing from Group B and supervised by Dr. Amar Ali Jabir. We hope you enjoyed the video. Thanks for watching. Bye!